Hello everyone, my name is Julia Sorber, and this is my case study for medical terminology. Hello everyone, I am a gynecologic oncologist. I run a private women's care clinic in Savannah, Georgia. This field initially interested me because I wanted to help women realize these forms of cancer are not something to be embarrassed about, but something we need to address and face boldly. After getting my feet wet in the field, I have become extremely passionate about women's health, and that is why I'm here. I've chosen to speak to you today about something that is not spoken very often about, and that affects many lives around the world: cervical cancer. With my specialty, most of my patients are those who have been diagnosed with cancer. In just the past year, I have seen 167 women come through my clinic with cervical cancer. These are mothers, sisters, daughters, granddaughters, nieces, and cousins. So many lives are affected by this diagnosis. It's something that we need to talk about. The typical symptoms of cervical cancer are abnormal menstruation, heavy menstruation, irregular menstruation, spotting, abnormal vaginal bleeding, abnormal vaginal discharge, fatigue, nausea, and weight loss. Treatment for cervical cancer include a hysterectomy, radiation, or chemotherapy. The human papillomavirus, the HPV vaccine, may help prevent cervical cancer. A hysterectomy is treatment for early stage cervical cancer. This would take a day or two in the hospital and then a few weeks for recovery, and it is the shortest treatment plan. Radiation would be used if the cancer has begun to spread to other organs. The actual radiation only takes a few minutes, but the course of treatment is 5 days a week for 6 to 7 weeks. Chemotherapy often happens while people are undergoing radiation, so they're paired. Chemotherapy is administered weekly for about 4 hours before radiation occurs. Chemotherapy is a treatment that may be used for several stages of cervical cancer, so it just varies depending on the patient. The HPV vaccine is given in hopes of preventing cervical cancer, just stopping it before it even starts. I will give you an example of a patient I had recently with cervical cancer. I must change her name for patient confidentiality, so we will call her Nancy Patterson. Nancy was a white 32-year-old female in the upper middle class. She was healthy as a horse other than a torn ACL in high school and an occasional hypertension due to her high levels of stress as a lawyer. She had no personal history of cancer, but her family history was scattered with it. Her father had lung cancer, her grandmother and her aunt both had breast cancer, and her cousin had prostate cancer. Nancy was experiencing some pelvic pain and abnormal menstruation, so she went to her OBGYN, who took a pap smear and found cancerous cells and sent her to me. I chose to give her a choice. She was still in the early stages of cancer, so she could easily have a hysterectomy and get rid of the cancer completely. However, this would mean she could no longer physically carry children. Radiation and chemotherapy may cause infertility, but since Ms. Patterson was younger than 35, she had a higher chance of being able to get pregnant after the treatment. Ms. Patterson still wanted the option of bearing children, so she chose to undergo radiation and chemotherapy. After 6 weeks of radiation and chemo, Nancy was declared cancer-free, and she is currently in remission. As far as we could tell, the ovaries were not damaged during treatment, so she should be able to bear children with little to no complications. Many times as a society, we veer away from talking about the reproductive system because it can be awkward. However, educating the youth, young adults, and even adults about the possibility of cervical cancer is very important. One of the biggest preventative measures is visiting the OBGYN every year after someone becomes sexually active or when a girl turns 21. Another measure that can be taken is getting the HPV vaccine. Educating women on the symptoms of cervical cancer is very important because, like I mentioned previously, people often feel uncomfortable speaking about the reproductive system. This awkwardness or embarrassment may cause someone to ignore their symptoms and allow the cancer to metastasize and get worse. To other doctors, nurses, and technicians that may be treating patients with cervical cancer, I would just like to say, know how sensitive this is for women. A woman's reproductive system is a miraculous system that can literally form a life. Having that be diseased and through treatment possibly permanently damaged is a very hard thing to go through. So when treating these patients, just be especially aware of their mood on a daily basis. The patient will be coming in many times a week and their mood will change. Read the room and know whether it's okay to engage in conversation with them or if they simply need you to just be a pleasant and quiet caregiver that day. As far as improvements in cervical cancer care, there needs to be a better way to target cervical cancer through radiation. With this new radiation, there should be no possibility of infertility. The radiation would be so accurate they would only target the cancerous cells and not have the possibility of bouncing off and hitting the ovaries or fallopian tubes. Other than that, I think the only improvements to be made would be in educating the general public and taking away that embarrassment that's there for no reason, really. So that's all I have to say. Thank you.